So doctors are seeing more people with epilepsy. That does not mean the prevalence has increased. It is just that mindset towards seeking treatment has changed.
Epilepsy can have a lot to compete with, especially in some low to middle income countries where a population can still be struggling to combat things like tuberculosis, polio, and other infectious diseases. Well, that is why the determination and the strength of clinicians like epileptologist Dr. Zarine Mogal is key. Today, Zarine tells us all about how she and her colleagues have reduced stigma and improved the lives of so many people affected by the epilepsies in Pakistan by playing the long game. If you're new and you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get more people learning about and having a better understanding of the epilepsies.
Thank you for having me over on your podcast. I am a neurologist. I'm an epileptologist. So I have a degree in neurology, and then I did my clinical fellowship from the Westmead Hospital in Australia. So I have been practicing in Pakistan for the last, say, around 3 decades, and I have been associated with this program that we have initiated since about 27 years. And since we've been working randomly since 1989. However, since 2001, we have launched this comprehensive epilepsy control program of Pakistan, which has two arms. One is the awareness and the other is the management. So the awareness part is the Epilepsy Support Pakistan, which is the full chapter of IBE, and the National Epilepsy Center, under one roof where we operate, has been in place since 2007. Here we do holistic management, and especially we look into the care of the marginalized people, because epilepsy is a chronic disorder, and the socioeconomic status does not allow them to take, rather lack of awareness and the socioeconomic status, to take continuous medicines. So we support them with medicines, with holistic management, with awareness, and it is located on the premises of the main public sector hospital in Karachi, which is the port city of Pakistan. And besides the land and some utilities, everything is through individual and some concerned citizens and some corporates who help us out and through their donations.
You kind of mentioned indirectly stigma, which is a big deal everywhere, but I think compared to, say, the UK, is a bigger deal in Pakistan.
So, we had done this population-based study in 1985-87, and it was with Turkey and other, 4 countries. It was under the guidance of Professor Simon Shorwin, and that was the time we even did the knowledge, attitude, and practice study, and we had found that there was a stigma, and we looked into that. Was our basis of our work on which we built our entire program. So we found out that the treatment gap was very high. In the urban areas, it was about 72%, 70% plus, and in the rural areas, it was as high as 99%. So
Wow.
we made that the basis. For that, we have 3 publications in place, and in epilepsia, and that was a formal basis on which our program was established. So now after that, what we did was we first went into and we targeted creating awareness of the disorder. And first we started with a very small message. Epilepsy is a treatable disorder. It is not due to any supernatural causes. Please go and see your doctor. So when that was drilled in, and we believe that sustained awareness is very, very helpful in decreasing the treatment gap. It's the sustained awareness. It's not celebrating a Purple Day or a International Epilepsy Day. Every day has to be an Epilepsy Awareness Day. So, with our sustained awareness programs, we created these indigenous programs. We started taking baby steps and then went to big formulations. And now, finally, and we kept it very flexible and open ended because, programs that come with financial aids and all, they are very closed ended. They have this time limit, and after the time limit is over, what happens? Uh, they are back to square one. There's nobody to fund them. There's nobody to. So we try to, instill into them that we are helping you out, but you have to help yourself. And if you get treated, are good to go. And so we have spread our message all over Pakistan through various programs, and the details of which you will find in our paper that has been published in Epilepsy and Behavior. So after that, the final stage that we came in was we have prepared a small, less than 1 minute documentary, which we air on the satellite regional television channels. It is a paid telecast. When we had the resources and the things were cheaper, we used to have it twice a day, every day for 3 months. So now it has gone to once a month cycle, and as and when. But the small awareness activities, they keep on going. And so we believe that to decrease the treatment gap, one needs to create sustained awareness.
I just have to come in here. I love your angle on this because, for instance, when it's Purple Day, I'll say like every day is Purple Day or every day is International Epilepsy Day. It doesn't stop, right? I think we need to become more like mental health, where I'm not sure what it's like in Pakistan, but over here, like we're always talking about mental health, which is great, right? But we need to be doing the same with epilepsy. The symptoms, the causes, they don't disappear overnight. They don't appear just twice a year on these awareness days.
And Torie, I'll tell you one thing, we have had these wonderful, experiences, and we say that the marginalized ones, the uneducated people, oh, they are the ones who have come out of the shadows. The doctors are seeing more patients in their clinics. And they are coming out, and for the local terminology for epilepsy is mirgi, and they come out and saying कि मेरे बच्चे को, that means my child has epilepsy and we are seeking treatment. So that is a big thing. It is a big shift. People who did not want to utter that word are coming out, and some of our neurologists, they claim that the prevalence of epilepsy has gone up. We did a second population-based study in 2006 after 5 years of our sustained awareness. The prevalence remained the same. The only difference is the awareness that we have created. People are seeking more, treatment, and therefore they are coming more to the doctors. The doctors are seeing more people with epilepsy. That does not mean the prevalence has increased. It is just that the mindset towards seeking treatment has changed.
That's amazing. And I guess that's how you are measuring the effectiveness of your work, right? Seeing change in communities.
That is one point. And what we had done is that population-based studies, are very, very difficult, as you may be aware of it. So one we did in 1985. Then after 5 years of our whole sustained awareness program, we needed to see whether, how much have we achieved? Are we just going blindly or not? So we repeated the population-based study, and in that same area. Unfortunately, we could not go into the rural areas because of the security reasons in the country that prevails. But we did it in the urban areas, and there was a major shift, we had expected 50%, but the treatment gap which was 70+%, it came down to 25%.
Oh, that's amazing.
So that is the direct scientific method which the international bodies would like to see. Now, population-based studies cannot be done left, right, and center, and they are very, very time-consuming. They are very, hefty. So the other method that we chose was an indirect method. We have this very renowned international body which collects data on the sales of different drugs. So they have been very kind that over the years they have shared us the data, and then here, we have been seeing the sales of anti-seizure medications. We have been measuring their increase in the growth from our baseline since 2001 to now, and the compound average growth as of 2024 is 17.5%. So that is a major shift without any changes. Only and only sustained awareness has helped us.
Awareness, I think, and understanding, which challenges the stigma and enables people to come forward to seek help. What would you say then the next 5 to 10 years holds for what you're doing? I assume, we know you're on the right track, so I guess you're going to keep doing the same thing. What do you expect to happen?
We have very few neurologists. We have a team of about, say, 450. But 450 people for 2.2 million people with epilepsy. 1% of our population has epilepsy. So that is not enough. So we are training the general physicians, we are training the specialists, we are training the healthcare workers and the psychiatrists who have been overlooked. There is always a professional war that is going on. We are addressing the gynecologists because the gynecologists are not aware of how to handle a person with epilepsy who comes to them, and they themselves go into a panic. So we've started with that, and we'll be going around in the country and doing that this year. For the government, epilepsy is not a priority because they have other priorities. They have not been able to combat tuberculosis, polio, other infective diseases, disorders, and it is only and only the clinicians, till the time they take this thing in their hands, nothing is going to happen.
Zarine's passion and persistence and dedication are inspiring to us all. Learn more about Zarine and her work on the website torierobinson.com, where you can access this podcast, the video, and the transcription of the entire episode all in one place. And if you're new and you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get more people learning about and having a better understanding of the epilepsies around the world. See you next week.